Hi, this is Jane Morton, and this is part 2 of our series, Welcome to Medicare. Again, I work for the Western Montana Area 6 Agency on Aging. We serve Lake, Lincoln, Mineral, and Sanders counties and the Flathead Reservation. We are located at 110 Main, Suite 5. Our local phone number is 883-7284. The toll-free throughout Montana number is 1-800-551-3191. I'm a SHIP counselor. The Montana State Health Insurance Assistance Program, or SHIP, is run by the state of Montana, and they train and certify counselors to help people with Medicare issues. In the Polson office, we have 4 certified SHIP counselors, but we also have people who live, certified SHIP counselors who live in Lincoln, Mineral, and Sanders counties. You can call the Polson office if you want us to put you in touch with one of those people. You can call the Social Security Administration for Medicare questions also. Here are the numbers to the Missoula and Kalispell offices. We strongly recommend calling one of the offices rather than calling the 1-800 number for Social Security. In section 1 of our Welcome to Medicare series, I talked mostly about Part A, hospital insurance, and Part B, medical insurance. In this section, I'm going to talk about Part D, prescription drug coverage, and the Medigap insurance. I'm not talking about Medicare Advantage yet. I'll get to that in Part 3. Okay, Medicare Part D is prescription drug coverage, and it's offered by private insurance companies who are under contract with Medicare, so they have to follow Medicare's rules. You can get prescription drug coverage in a prescription drug plan to go with original Medicare. You can also get prescription drug coverage as part of a Medicare Advantage plan. Again, I'll talk more about Medicare Advantage plans in section 3 of our training. Well, when do I start Part D? Well, nobody is automatically enrolled in prescription drug coverage. Everyone must actively enroll to get prescription drug coverage. The initial enrollment period, around your 65th birthday, is the same as for Parts A and B. If you are still working and you want to keep your employer insurance and delay Part B, then you don't need a prescription drug plan because you have prescription drug coverage in your employer insurance. But once that employer insurance is ending, you have 63 days to get drug coverage, and then you won't have a late penalty. This graphic just shows that initial enrollment period, and just like with Part A and B, if you sign up for a Part D plan during the 3 months prior to your birthday month, it will start the same month as your Medicare, the same day as your Medicare. If you delay and sign up during your birth month or during that 3 months after, you won't have a late penalty because you're still within your initial enrollment, but your Medicare won't start until later. Well, what do I do to start Part D? Well, you use the Plan Finder tool on www.medicare.gov. If you Google medicare.gov, make sure that you choose the official site, because there are a lot of other sites about Medicare that aren't really the official government site. Then once you're on medicare.gov, go to the Plan Finder tool. You put in your prescriptions, and it will tell you what's the most economical plan for you that covers the prescriptions that you need. And you can find out what the monthly premiums would be and also what your co-pays would be when you pick up your prescriptions at the pharmacy. And you can go ahead and enroll online right on the same site. You know, once you pick one, you click the enrollment button, and then it's just like filling out a enrollment form. We help people all the time with the Plan Finder tool. We help them compare plans, pick a plan, and then we also help them enroll. You can also call the company and enroll over the phone if you prefer. We don't recommend that just because it takes a lot of your time. I've helped people with that, and it's not the quickest way to go about it. If you have difficulty affording your Medicare Part D plan, and the prices of those range, I think the cheapest one this year is $17 a month, and they go all the way up to $100 and some a month. Just depends on what your needs are. If you can't afford to pay that monthly premium for prescription coverage, there is an assistance program through the Social Security Administration called Extra Help, and you just apply right online for that, and it has income and resource guidelines for single person or couple. If you don't quite qualify for the Extra Help program, you may qualify for the Big Sky RX program. This is a program through the Montana Department of Public Health and Human Services. It only helps with premium assistance. It doesn't make your co-pays any lower than it already is with your insurance, but it does help pay for the premium. Now the maximum they'll pay is $35.40 a month. Most drug plans cost less than that, so in most cases Big Sky RX will pay your whole monthly premium to have a prescription drug insurance plan. It has income limits, but it has no asset limits. So if you have a family ranch, they're not going to consider that. If you have, you know, a boat or an RV or something, but your income is pretty low, they don't consider asset limits. So the nice thing about Big Sky RX is they only go by income. The benefits checkup program is something run by the National Council on Aging. There's a special part of the program for the Montana Department of Health and Human Services that helps us find out what benefits in Montana you may qualify for. And there's no identifying information, but we put in some of your financial information and it spits out a list of what programs you may qualify for. And then if you decide you want to apply for one of those programs, we can help you with completing the application, whether it's online or a paper application or whatever it is that you need. We can help you with that. Here are some common mistakes that people make about prescription coverage. I want to talk about the one on the bottom first because that's the one I see the most often. Is people come in, they're turning 65, they're still relatively young and healthy, and if they don't take prescriptions or their prescriptions are really cheap, they say, well, I don't need prescription drug insurance. I don't need it. And you never have to get a prescription drug plan. But if you don't get a prescription drug plan when you're eligible, and then years down the road you suddenly have more expensive meds and you really need some help, and you want to get a Part D plan at that time, then a late penalty has been accruing ever since you became eligible. As I said, the cheapest prescription drug plan is $17 a month, and we highly recommend that you sign up for the cheapest plan if that's all you need, or if you don't really take any drugs. Then you've got prescription coverage, you know, if you just have to get some antibiotics or whatever. Also, you can keep that cheap plan until you need a better one, and you won't have any late penalty. And we'll talk about a chance to change plans a little bit later. These next two, choosing a plan the same as your spouse, or choosing a plan based on name recognition, it's something you saw on TV and it sounds good. We don't recommend those because a lot of times people end up paying for more coverage than they really need. Even, you know, if your spouse has a plan they're really happy with, they don't necessarily have the same prescriptions you do, so they don't need, they need more coverage than you do, or maybe you need more coverage than what they have. So we really need to go on the Plan Finder tool and find out what's the best plan for you. And then the top one, staying with the same plan every year. A lot of people will go, oh, I'm happy with my prescription coverage, I haven't had any problems, I'm just going to let it roll over to the next year and then I won't have to do anything. The trouble is the plans are allowed to change their pricing every year, or change what they cover, or change what states they offer plans in, or drop plans, or change the name of plans. And you can get caught paying for a lot more coverage than you need if you just stay with the same plan and don't ask any questions. Every year during open enrollment period, which is October 15th to December 7th, you can go into that Plan Finder and compare the plans that are going to be available for the following year. You can compare prescription drug plans or Medicare Advantage plan drug coverage. And if you want to leave it the same, all you have to do is nothing. If you want to change it, it's a matter of a really quick enroll online for the next one. Your old plan stays in effect to the end of the year, but then you get switched automatically to a new plan at the beginning of the coming year. There are different ways to compare plans. Medicare Plan Finder on Medicare.gov is the best way. You can call 1-800-MEDICARE if you want a headache. You can get an appointment with a SHIP counselor and we just help you use the Medicare Plan Finder. We talked a little bit during the first section about late penalties for A and B. We're going to go back over that and also talk about the late penalty for Part D. Now, most people don't have to worry about a late penalty for Part A, because if you are qualified for premium-free Part A because you or your spouse had 10 years or more where you paid payroll taxes, then whenever you sign up for Part A, there is no late penalty. The only people that have to worry about a late penalty for Part A are the people that don't qualify for premium free and are going to pay a premium to get Part A because that's what they want to do. They want to watch out for a late penalty. Part B, everybody has to worry about that late penalty. We talked about the initial enrollment period that you have to I'm sorry. We talked about the initial enrollment period that you want to be in. If you miss that, or if you miss your special enrollment period when you quit working, even if you still apply during the general enrollment period, if you have gone for a full 12-month period without any insurance coverage from the time you became eligible for Part B. You pay 10% for each full 12-month period. Now you're thinking, oh, 10% of $144.60, that's not so bad. But that's a penalty for life. That means every month you'll pay an extra 10% for the rest of your life. If you wait 2 years and then you want to get Part B, you'll pay an extra 20% every month for the rest of your life. If 10 years go by and then your medical bills are so high, you got to get Part B, you'll pay an extra 100%. So basically you'll be paying double every month for the rest of your life. Then for Part D, prescription coverage, if you've gone without Part D coverage, there is a 1%, it's 1% of the national median plan price. Well, the national median plan price at the present time is about $34, $35. So, you know, 34, 35 cents, you might think, oh, big deal. But that's for each month that you weren't enrolled. So 35 plus 35 plus 35. If you go just a year without Part D, we're talking, you know, $4 or $5, and you would have to pay that $4 or $5 extra every month for as long as you had Part D, which is usually for the rest of your life. I've worked with people that never got any prescription coverage, didn't think they needed it, and then when they get older, their meds all of a sudden are so expensive that they need prescription coverage. And they come in and we figure out what their late penalty would be, and sometimes the late penalty is higher, you know, more than the monthly premium. But it'll still save them so much money, they make the choice to bite the bullet and pay it. So to get Part D, they pay the premium plus an extra 100% just to get some insurance to lower those prescription costs a little bit. So no penalties, no late penalties are worth getting. They're really ugly. And a lot of people have messed up, you know, not taking care of something in a timely manner, and then come in, well, what can I do to get rid of this late penalty? We can't get rid of the late penalty for you. They're pretty much buggers about that. Okay, I need to back up just a little bit to that. So we've talked about hospital insurance and medical insurance and adding prescription coverage. So that's with original Medicare, and a lot of people, that's all they have. And they figure, well, I'll be okay, I can pay the deductibles, I can pay the 20%, I'll be okay with just this. Sometimes people want to get a Medigap plan, which is additional insurance you can get from the private sector, and it pays, you know, these deductibles and copays here. It costs about $100 a month, give or take, depending on what policy you pick, and it's going to go up as time goes by. Now let's go back and talk about Medigap plans. Again, Medigap helps with your out-of-pocket costs like deductibles and copays for original Medicare. There are some different plans to choose from that have different coverage, ranging from the very basic to pretty much complete coverage. And of course, the basic ones are the least expensive, the complete coverage ones are the more expensive. And the plans are standardized, which means if you choose a plan B, for example, or plan C or plan G, you can go out and comparison shop. The plan, if you pick a plan G, for example, plan G has to be the same from this company and this company and this company. Just like if you're shopping for apples, apples are apples are apples, but not everybody charges the same for those apples. A Medigap G is a Medicap G is a Medicap G, but not every company charges the same. So you can comparison shop knowing you're actually comparing the same thing to the same thing. This is a chart that shows the different Medigap plans that are available. Don't confuse this with Medicare Part A and Medicare Part B. These are plans, Medigap plans, Plan A, Plan B, and you can see them listed here. I'll just briefly go over this chart. From here on up, all Medigap coverages, all Medigap plans cover these items. A check mark means they cover 100% of your share of the cost. Otherwise, it shows what percentage of your share that they pay. Part A coinsurance, this is if you're in the hospital longer than 60 days and you begin having co-pays that you have to pay. Any Medigap plan will pay for that. Under Part B, Medicare pays 80% and you pay 20%. Any Medigap plan will cover that. Under both A and B, you're responsible for the cost of the first 3 pints of blood if you have to get blood, but any Medigap plan will cover that for you. Part A, hospice care, most things are covered at 100% anyway, but there may be some small co-insurance or co-pays involved in hospice, and any Medigap plan would cover that. Then when you get down to here, you can see that only some of the plans cover them. Skilled nursing facility care co-insurance. If you've been hospitalized for a minimum of 3 days and you've used up your 20 days of skilled nursing facility care that Medicare pays for, but you need to stay there longer, and you're going to have a co-pay for each day that you stay. You see Plan A and Plan B don't cover that, but these other ones will cover that for you. Part A deductible, if you get put in the hospital under original Medicare Part A, you have to pay that deductible of $1,400 approximately. Plan A won't cover that. You'll still have to pay it. Any of these other plans will pay that Part A deductible for you. None of the plans cover a Part B deductible, but the Part B deductible is an annual deductible. That's $198, so it's a pretty small amount. Part B excess charges, only one plan will cover excess charges. If you choose to go to a doctor that doesn't accept Medicare assignment, that means they take Medicare but they didn't sign an agreement with Medicare to accept what Medicare allows. They charge 15% higher than what Medicare allows, and Medicare doesn't pay any of that extra 15%. The best example of this I can think of is the Mayo Clinic. If you go to the Mayo Clinic, Medicare will pay 80% of what they allow. You have to pay 20% of what they allow, and you have to pay all of that extra 15% higher than what Medicare allows. But if you have a Plan G, it will pay any excess charges. Foreign travel emergency, Medicare doesn't pay outside the United States, but some of the supplement plans will pay for your costs if you have a foreign travel emergency. The out-of-pocket yearly limit only applies to these plans that only pay a portion of your share, in which case there's a cap on what you could have to pay, and then if you have a catastrophic event, you're limited in what you're liable for, and then after that they'll cover everything 100%. The Medigap industry, as I said, is a private industry, and so it's not controlled by Medicare. It's controlled by, or it's overseen by the state insurance auditor's office. And we got these two books on their website. This one is just a general guide about how Medigap plans work. This one is a rate comparison guide so that you can look up what companies offer the plan you're interested in and what their price is. In the back of this book is contact information for all the companies. We can't help you sign up for a Medigap plan. You have to go, it is a strictly private product, and so you have to either call the company directly or go through an agent to get Medigap insurance. You can go on the state auditor's website, is csimt.gov, and find the same information. We just printed it off their website, but we'll be happy to mail you a copy of it if you'd like. And this just reviews that the premiums for Medigap insurance vary based on your age and how much coverage you choose to get. Some plans tie the premium cost to the age at your initial purchase or issue age. So if you first get a plan at 65, then your premium cost is always tied to age 65. That's an issue age plan. More of the plans are attained age plans. That means the premium is structured to go up every year you age. So your premium cost is tied to your attained age. Your premium cost is based on however old you are at that time. And then of course your deductibles or your co-pays depend on the plan that you purchased. There is one really good consumer protection in Medigap insurance, and that is the Medigap open enrollment period. Once you start your Part B, there's a 6-month window where you have guaranteed issuance rights. That means they have to accept you. If you want to buy it, they have to sell it to you. Once you have it, as long as you keep paying the premiums, they can never drop you, no matter what health issue may arise for you. Once you're outside this 6-month guaranteed acceptance period, they will ask medical questions. They may give you a medical questionnaire. They may require a physical. They can turn you down. They can say, well, you could have it, but you know, the cost would be higher for you. They can do underwriting for pre-existing conditions outside the 6 months. As long as you're within the 6 months, they can't do any of that. But outside the 6 months, they can and will do all of that. Again, it's regulated by the Commissioner of Insurance, or also called the State Auditor's Office. And their website is there, but if you want us to mail you a booklet, we'll be happy to do that. When you have more than one insurance, the insurance companies always want the other guy to have to pay first. So you need to know that Medicare is primary to a Medigap plan or retirement health insurance or Indian Health Service or Medicaid. Medicare is primary to all those, so they won't pay until after Medicare has paid everything it has to. If you are on employer insurance, and remember it has to be If you have employer insurance based on someone's current work, either you or your spouse, that's usually primary and Medicare is secondary to that. And that is the end of Part 2. Again, we're Western Montana Area 6 Agency on Aging, and we can be reached at the phone number shown here.